Hey guys, this is Dr. Will McClure, and I'm here to talk with you guys a little bit about high blood pressure. I've gotten a couple questions about it, and I think it's pretty important to Black and brown communities. So we'll spend a little bit of time on high blood pressure and why it's important and what to do about it. So what is high blood pressure? High blood pressure is when the pressure in the arteries are essentially the highways of the blood that take blood from the heart to the rest of the body, when that pressure is too high. So the force of the blood that's going through the arteries is too high. So the heart is having to pump harder when you have high blood pressure. So why is this important? This is so critically important because high blood pressure leads to an array of really bad things, including kidney disease, heart disease, as well as strokes. And so it's really important that we have a good understanding and try our best to prevent from getting high blood pressure, or if we have it, to reduce and control the symptoms and the further effects. So what are the risk factors of high blood pressure? Increased age. So as we get older, our chances of developing high blood pressure increase. Tobacco use, including vaping. Increased alcohol use. So for men, the max is kind of 2 per day. And for women, it's 1 drink per day. So increased use of alcohol increase the risk of high blood pressure. Added salt to your diet. So having a diet that's rich in salt is not good for blood pressure. As well as family history. So family history plays a huge role in whether or not a person is at an increased risk of developing high blood pressure. Lack of exercise is also an increased risk. Obesity. So how is high blood pressure diagnosed? So typically you've heard of top number, bottom number. So the top number is the systolic blood pressure, or that's the pressure that's in the arteries when the heart is contracting. The diastolic number, the bottom number, is the pressure in the arteries when the heart is relaxed. So the systolic blood pressure is going to be higher than the diastolic blood pressure. So high blood pressure is diagnosed when your top number is greater than 130 and your bottom number is greater than 80. So typically we want most folks to be less than 120 over 80. But again, we diagnose high blood pressure when it's greater than 130 over 80. So how can I reduce my chances of developing high blood pressure? Or if I've been diagnosed with high blood pressure, how do I control it? Number one, if you're using tobacco in any form, including vaping, stop. I know it's easier for me to say it than for you to do it, but if you want to really achieve optimal health, you've got to cut out tobacco. Number two, exercising. And you have to do what you can, where you can. So if you're in a particular area where you don't feel comfortable walking, you can do some things in your home. You can go to the mall. Exercise groups are also pretty important. So anything that can allow you to get up to as much as 150 minutes per week is our recommendation. About 30 minutes, 5 days a week is going to be really helpful in reducing your chances of developing high blood pressure or controlling it. As well as making sure that your diet is controlled. So you want your sodium level to be less than 2,300 milligrams of salt per day, right? So a Big Mac and the fries is about 1,500 milligrams per day. So think about it that way. You've got to keep it less than 2,300 milligrams per day. Increasing the amounts of fruits, vegetables, whole grains that you're putting in your diet is also very important. You may be prescribed medications if your blood pressure doesn't adjust with the lifestyle modifications. And I'm not saying that you're going to be on medications forever. We take patients off of blood pressure medications all the time. But you've got to keep doing the things that we just talked about in order for the blood pressure to come down as well. If you are prescribed a blood pressure medication, please take it every day, all right? If you're feeling good, if you don't think you need it, don't stop taking it. Touch base with your doctor. And if appropriate, he or she will definitely take you off of it. But please don't stop it because we need it to stay in your system for it to keep working. So some common medications that you might be started on include a diuretic, which is a water pill. It makes you go to the bathroom frequently, urinate quite a bit. So you might have heard of Lasix or hydrochlorothiazide. Another medication class is ACEs or ARBs. So this is good for folks who have kidney disease or diabetes. You might have heard of lisinopril. Another medication is calcium channel blockers like amlodipine. So this works for folks who have chest pain as well as high blood pressure. Another medication is beta blockers like metoprolol, and this helps the heart by not having to work so hard. So it's important that if you've been started on a new blood pressure medication or if you've been diagnosed with high blood pressure, that you're checking your blood pressures pretty regularly. If we're changing medications or if your blood pressures have kind of been all off the wall, then you might want to check your blood pressure every day, maybe twice a day for at least 2 weeks. Understanding that it takes at least a week for the blood pressure medications to kind of kick in your system and start doing what they're supposed to do. So how we choose your blood pressure medication is based on a number of things, including how high your blood pressure is, what medications are you intolerant to, and what other medical conditions you might have, like diabetes or heart failure. These all kind of play a role. What I would recommend is that you write down your blood pressures every day or jot them down in an app and provide them to your doctor so that he or she knows exactly what your blood pressures are looking like and can adjust your medications accordingly. What I also recommend is that you take your blood pressure the same way every day. So making sure that you're not rushing in from the grocery store or lifting laundry from the basement or doing something strenuous and then take your blood pressure. It's absolutely going to be higher. So what we recommend is, number one, go to the bathroom, empty your bladder. And a full bladder can cause your blood pressure to be a little bit higher. I know, it sounds crazy. Sit in a chair. Relax for 4 to 5 minutes. Don't take your blood pressure as soon as you finish doing something. Relax for a little bit. Try to breathe normally and stay calm. And then take your blood pressure. Then what you can do as well to make sure that it's a good blood pressure reading, if you're taking it on the right arm, switch to the left arm and do the same thing to make sure that the blood pressure numbers are reading appropriately. Wow, I know, that was a lot. So let's recap quickly. High blood pressure is diagnosed when your blood pressure is greater than 130/80. Ways to reduce your chances of developing high blood pressure or controlling it if you've been diagnosed with high blood pressure: reduce your salt, stop smoking, decrease your alcohol use, increase exercise in your life. If you've been started on medication, stay on it until you've been taken off of it, and check your blood pressure numbers regularly. All right, if you have any questions about what we've talked about or you want to know something else, be sure, let me know, drop me a message, send me a text. I want to know how I can help you best. Thanks, guys. Make it a great day.